Bonjour, my name is Noel, reporting from HIMSS Global Conference and Exhibition, where healthcare meets innovation on a global stage. Here, at the heart of Europe, leaders in digital health, AI, cybersecurity, and patient-centered care are coming together to shape the future of healthcare. From groundbreaking technologies to critical policy conversations, we're bringing you the insights that matter. Stay with us as we explore the latest breakthrough, speak with key voices in the industry, and dive into the digital transformation that is redefining healthcare right here at HIMSS Paris 2025. One Media 2025. My name is Noel Steevens. I'm here at Le Palais de Congrès in Paris at the Healthcare Information Management System Society 2025. And I'm here with the one and only President CEO of HIMSS, Harold Wolf.
Welcome to HIMSS 25 Europe.
Thank you very much for being here with me on such a short notice. How is it being in Paris?
It's been great. It's really been an amazing week. First of all, it's Paris. Second of all, the weather has been phenomenal. Thirdly, all of the sessions have been packed.
Yes, I've been running from one to another all morning.
Some people can't get in, right? And fire marshal showed up twice going like, you got to get some people out of here. This place is overpacked. We've been actually a little oversubscribed in terms of number of seats, which is, part of the function of just everyone really absorbing what's going on. But it's been an incredible week and everyone's been amazed.
Wow, that's amazing. Now, the 25 next to HIMSS, is that the year that we're in? Or is it how many years HIMSS has been
around
the world?
It's the year we're in. HIMSS started in 1961 out of Atlanta, Georgia, at Georgia Tech University. Kim started in the computer science department with this crazy notion that some of the computer scientists came up with, that if we took a look at the data and the information that came out of the healthcare system, they could begin to systematize it, then they could actually come up with recommendations about how to improve care. Crazy talk, as we would call it.
And in the 60s, some people were really outside the box.
They were way outside the box, but this was where they started. And it really became a source of the academic medical institutions, and then that lent itself ultimately to the hospitals and the systems outside of medical institutions, meaning the classrooms and places in the universities where you're training doctors, and there's a lot of information training going on about how to use this new information and have the research behind it. And then from there it grew and grew, and then eventually meaningful use came along in the United States, which poured billions into developing an infrastructure, if you would, just like we're going through now in Europe with the Data Space Act and the funds that are coming through. So we're really seeing history repeating itself a bit, but HIMSS is really honored to be in the middle of all of that.
Wow. Now, talking about that being in Paris, I was also fortunate to have attended HIMSS in Las Vegas. So there's a pattern. It seems like you like Eiffel Tower, but you can't seem to choose which one you like more than the other.
And if we come across a third, we'll probably have an event there too.
I know a couple of places that have some, but they don't look the same as the one in Vegas and Paris are like the closest related to one another.
I personally will take the one here versus the one in Vegas. We love Vegas, but Paris is Paris.
HIMSS again.
Because actually the HIMSS Global Conference will be in Vegas this March again, and we're really excited about that as well.
We will see you there. Stay tuned. Now, United States and Europe have a different healthcare system in a way, like we have, healthcare for everyone versus a little bit more privatized system that we have back in the States.
Right.
What are you seeing? How is HIMSS trying to bridge that gap? What are you learning from one to apply to the other, or vice versa, to help? What are you seeing that's positive on both sides?
So, it's a really great question. So, when we think about privatization versus public, we're really talking about the financing functions, if you would, of healthcare. How does the government or how does the individual go to pay for the care that they receive? Both sides have accountabilities for population health management.
Yeah.
And both have different methodologies of paying
Yeah.
or making funds available. So in Europe, as you know, there are very different healthcare systems.
Yeah.
You can look at something like the NHS in the UK, which is pretty encompassing, and you can have cradle to grave coverage, right? If you go into Germany, the government doesn't do healthcare like they do at the NHS, but they have a supplemental system in conjunction with insurance companies that make sure that all individuals can have coverage
Yes.
through insurance, and then those offerings are the same, which was really kind of the goal behind Obamacare in the United States, right? Make it so that it's easy for people to get insurance, and if they don't have the funds available, supplement will come from the government.
Where it's needed. Okay.
Right. So,
Okay.
so from a functional standpoint, financially, they're coming together. But where HIMSS plays isn't so much in how the money gets rendered, but what do you do with it?
Okay.
Because right now, what's happening on a global basis is that no one has enough money, no one has enough staff, populations are aging,
Yeah.
and they're bringing with them more and more chronic disease management, which really means we've got elderly to take care of without really enough staff behind it.
You know,
And this is
yeah.
where digital health comes in to support and supplement that care, and that's what's going on all around us right now.
It's very interesting to say, because every now and then when I have this conversation with peers of mine about the birth rate not being, going down, and they're like, no, everybody I know has 4, 5, 6 kids. On a global scale, it is, but for a lot of people, they don't see it because they're looking at their neighbor or someone next to them like, well, I'm not having kids, but my friend here just had 6 kids. How can you tell? It is happening.
It is happening, and if you look at different countries, people are in different places, but if you look in Europe, the birth rate is below.
Yeah.
So you look at the birth rate in conjunction with the individual, or you can look per couple. But if you look in places like Italy, the birth rate is well below 2 people being replaced by 2 people, right? It's down at 1.x.
Yeah.
When you look in places like Korea, it's 0.7 for every 2 people.
Oh, wow.
So you really have some
yeah.
significant
Wow.
challenges in terms of birth rates, because it's expensive to raise a family, and
Yeah.
it's difficult. So these are economic, which are turning, of course, into socioeconomic reflections, and that puts more strain on the healthcare systems.
Yeah. And going even further is with a lot of the jobs, because let's go back 40, 50 years, you grew up, you learned the trade of your parents, and then you fall right into there and continued. Now there's a lot of my generation that don't want anything to do with what our parents did. So that leaves a lot of gap once they retire for someone to take over that role, because it's still necessary, especially in healthcare.
Well, that's true, and you're raising a really interesting point that's been discussed for a long time.
Yeah.
Since the 1800s and more. You can actually go back into great writings, and Karl Marx, as an example, wrote that in the Industrial Revolution will ultimately dissipate the roles that we all grew up with, just like you said, which is I'll go into my parents' business.
Yeah.
That gets overtaken by large chains or large entities. Then the workforce has to move to go find places to work, and that disconnects us from our nuclear family. And now suddenly that grandparent that used to live down the street, to your point, with their kids close by, that they could even go and watch while the parents went to work.
Yeah.
And when they became disabled, moved into their kid's house.
Yes.
They're in different
That doesn't
cities,
exist
sometimes
anymore.
different countries now.
Yeah.
So it's a different world.
For the latest news and articles on HIMSS 2025 in Paris, go to send1media/what's the story. Now, let's get back to the story. You kind of touched on it a little bit, but what role does the society play in shaping the next generation of healthcare information and digital health landscape?
Yeah, well, we are going to continue to try to play as large a role as we can. But the 3 things that we do a tremendous amount of right now is that from an advisory standpoint, we work with healthcare systems to give them through our maturity models and our fundamental activities from advisory, and say, look, if you invest in technology and complement it with the people, changes and the process changes, you should be able to achieve these outcomes.
Okay.
And then those outcomes will produce better access, better quality, health equity as well. And that information, what we call maturity models, comes from literally taking input from our 125,000 plus members globally. We take best practices, we think through analytically, how can we prove that and how can we show that to people? And that check mark becomes extremely important by saying, if I achieve this, I can achieve that. Right?
Gotcha.
And we do that in multiple disciplines within the healthcare ecosystem. But it's never just about the technology. Okay. It has to be about the people and the process that go with it.
Yeah.
And there's an old formula, and I'll share it with you, developed by a wonderful guy named Mike Chase, Dr. Michael Chase. And it said NT plus OO equals COO. And that means new technology plus old organization equals costly old organization. So you just can't throw technology
into
and call it a
mix.
day.
Yes.
You got to figure out how to use it. You got to reinvest your people, and you need to change your functions.
At HIMSS in Las Vegas, I spoke to a doctor from San Francisco that I was attending, and he says, I love everything about AI. I love what it can do and the possibilities. However, what I don't like is when I show up one day and there's a new technology that now I have to learn. Instead of the technology making my job easier, now I have, on top of everything that I'm doing and taking care of my patient, I have to now learn this new thing. And instead of the thing learning how I work, I need to learn how it works. So it's like the integration needs to be a little bit more seamless, more instead of, us doctor learning how AI work, AI need to learn how we work.
Yeah, no question.
Better.
I think that's exactly right. Having spent many years of my career working with physicians and developing applications to fit their needs and developing clinical decision support and knowledge management libraries, we're in a new path today where before we could develop a technology, and your phone's a great example of what you have in your hand, right? If you go back 10, 15 years ago, what an app could do, it's pretty different than what an app can do today. And so, and so now when people go in the exam room, they have that option in many cases of just not having to type things in, but talk. And in the background, it's being captured and being put into the record or creating a transcript that before only could happen if you were manually typing. That allows the physician to turn to the patient as opposed to turn to the computer. And that's a huge difference, right? So technology is becoming more intuitive. Technology is becoming more ubiquitous into what we do. And that's the key to engagement. I wear a ring that monitors my sleep. I have another ring that can monitor blood pressure. We'll put them all together in a ring in the future. But all of that means that I'm keeping track of myself. My doctor doesn't have to. And then if an anomaly occurs, I go to my doctor because I have something to talk about, right? So our opportunities for prevention, primary and secondary, are getting better. And yes, a lot of work's going in to make it as intuitive and non-pervasive, right, for the doctors as we've ever had before.
Now, you just mentioned something about your ring that monitors your sleep and stuff like that. Let's say it detects an anomaly. How, now you were talking about that connectivity versus your ring and your doctor. How does your doctor not either know before you even show up that there is something that's out of the ordinary, or when you get there, instead of having to repeat everything what happened to you over the last 3 months, your ring can already give him or her a list of like, this is what happened, this is where it happened.
So this is like the magic question. Right? Or as we used to say in the old days, the $64,000 question. So let's go through that. So there are two types of devices. There are devices that are medical devices, which means they're measuring medical components, and they're certified by any particular government, whether it's in the European Commission or whether it's the federal government of the United States, that says that the data coming off of this has been so validated that it can go directly into the record. And it can be used, and you can take it verbatim, right? That blood pressure measurement's just as valid as if you put a cup on the person, do the pumping and all that. Okay. So that's kind of the first point. The second point is There are other devices. This one I'm wearing, it's not designed as a medical device for a doctor, but it does help me as an engaged patient figure out when I'm sleeping, helps me understand why I'm doing better in my sleep. And then on my blood pressure one, that is really an interesting, almost crossover.
Yeah.
So I'll give you a personal example, and I'm fine with that, which is slightly elevated blood pressure. I saw it was happening at 4 or 5 in the morning as my ring was measuring it. Went to my doctor and said, hey, this is not a medical device piece of information, but there's a trend here.
Yeah.
And they went, okay, well, let's move when you take your medication over to here and see what happens.
Yeah.
And it smoothed it right out.
Okay.
So the information I brought to them showed where the anomaly was occurring. Great word. Love it. It's the right word.
Yes.
That's what healthcare is. And then from there, we were able to solve a problem.
Yeah. And I think that's really important is being able to take that information and be able to digest it, because the other aspect of that, there's a lot of those devices out there, but people use them and there's so much information that it gives you, and if you don't, or if you're not properly trained to know how to decipher this information, it can make you go crazy. If it's showing so many things you don't know what they mean, because you're like, what happened? Like, am I okay? Find out more about HIMSS 2025 and other stories like it at send1media/what's the story.
Well, that's true. And look, let's take it back from your standpoint. You're looking at all this information and this data and you're trying to interpret it.
Yeah.
Now let's even take it from a physician point of view. So if I go back into the 1970s, there were 4 or 5 major journals in the world that were publishing roughly 10 articles a month. They'd show up in JAMA, New England Journal of Medicine, British Journal of Medicine, right? So you were roughly seeing 400 to 500 peer-reviewed articles per year being published in 1972.
Easy to keep up with.
Easy to keep up with.
Yeah.
If I'm really a diligent doctor and I'm looking at stuff that impacts me, I can read an article a day and I can pretty much keep up with the latest.
Yeah.
Last year, by many estimates, and you can kind of chat this out and look it up on AI, there were over 300,000 peer-reviewed articles published in healthcare.
How do you keep up?
Can't do it. So you need help.
Yeah.
We need knowledge management systems, and AI is brilliant at taking giant piles of information and finding what it believes, based on its training, are the relevant components for you to look at as a physician leader and say, yeah, that is relevant, it's not relevant, what's the source of that? I like where this came from, let me go look at it. Yep, I get that. This coincides with what I thought was happening, doesn't. And so it allows a practicing physician, nurse practitioner, clinician to keep up. Where otherwise you can't do it.
It's
right?
a lot.
It's too much.
It's a lot. Wow. Now, what are you aware of that is being done to attract the next generation of professionals into healthcare IT?
Yeah, we were taught, healthcare IT.
Healthcare period,
in general.
like period.
Well, they're kind of like two different things. So first on healthcare itself, there's a lot of people that still, thank goodness, for all of our sakes, want to get into healthcare, but we have capacity challenges. It takes a lot of years to go through school.
Well,
it's kind of costly.
For someone who is going to be in charge of your well-being, life, I don't think that's a part that should reduce how much training it needs. It could be help with the use of AI.
But that age gap, that birth rate has an impact, right? So if you looked up and you made up a number, let's make up a number and say that 10% of the world's population's in healthcare today. But our birth rate in many countries is not 1 for 1. So if it stays at 10%, that means there's less people in healthcare tomorrow than there was today, right? We're going to reduce it significantly. So we have to do a better job, again, of supplementing and encouraging people to go in, and that's going to take supplements in tuition. It's going to take opportunities for them to learn and put them in a position to win, right? Okay. Now, healthcare IT, it's a fascinating world. It's been changing. So if you go back 20 years ago, we spent a lot of our time integrating systems to talk to each other. Now we've spent more time implementing systems that do talk to each other. And now the focus is on how do I derive the information from those systems in order to create the right information points that get fed to my clinicians and my citizens, patients, consumers that are on the other side. And finding those common sources of truth so everyone can derive from the same information.
Perfect. Love that. Love that. Yes. We need you. We need you to get into this field. What is a technology or something that you
Well, I
see
think
has
we're
the biggest potential over the next
Oh, well,
3 to
that's
5
AI.
years?
I mean, there's no
Yeah.
question it's
Yeah.
artificial intelligence.
Yeah.
The ability to synthesize at a large scale basis,
Yeah.
the ability to anticipate the needs at the individual level, the population level,
Anticipate.
and the
That's-
organizational level. That's
Yeah.
in the anticipation. We have AI already being deployed in 3 different layers, right? So AI number 1 is like the devices you and I were looking at earlier,
Yeah.
your phone, my ring, whatever the case may be.
Yeah.
The second part where AI is being used already is in the operational layer. So that's the biggest deployment of it. And it's supply chain, resource utilization, bed capacity, when is it going to be available, even predictive modeling about who's going to walk through that door at any minute.
Wow.
So if I'm looking at, and we used to do this manually, so this isn't a big leap
Yeah.
by any means. But if you look at Google searches by your area, we would look once or twice a day. And if you saw suddenly people
Horizon.
Googling about, what does the flu feel like? And
Yeah.
what's a good,
Okay. The next, the door's about to bust open.
The board's about to bust open. Okay. So we don't do that
Okay,
anymore because
okay.
there's a little bot that's out there doing it for
Yeah.
us, right? And now we begin to see larger patterns that take place within population health, and we can do predictive modeling about what's going to happen tomorrow.
That's amazing.
And it is. And then that helps us understand, what nurses to be on staff, doctors need to be on staff. And then the next big leap, and this is the really cool part, is that as we're able to shift more and more into the home and to the individual level, we're shifting what we call in care scope of practice. Scope of practice means that a physician, a nurse, a clinician is practicing at the top of their license, that the scope of what they're doing is as broad as humanly possible. Humanly possible. But the
Yes.
non-human part now
Yeah.
can fill in and supplement to free up the humans
Yeah.
that we are in scarcity of, and it's going to grow, to be able to do whatever they can or when that touch is so desperately needed. And by the way, it's always going to be needed.
It is.
So, if I were looking at my kids, I'd say nursing, amazing.
Yeah.
Physician, great. Clinician, great. There's always going to be a demand in healthcare. It's a wonderful field.
Amazing. Now, last question. What kind of people, business professionals or policymakers would you like to be more involved with HIMSS or see at the next HIMSS conference?
Well, astounding. I mean, where HIMSS has been blessed is that we are a society. So what does that mean? So there are things called associations, and associations usually have pretty narrow scope of focus. It's an association. It's focused on just technology. It's focused on, trucks. It's focused on cars, aviation. But when you're looking at healthcare, it's a society because we recognize it takes a very broad view. So where we are, for the people that come in, we would love the regulators and the politicians to understand the full scope of what they bring forward. And we work very hard to do so. We work with ministries of health, and we want to get them to understand the full scope of the capabilities that are in front of them so that the funding and the regulatory environment propagates the global health ecosystem, the global app system, and promotes digital transformation.
Thank you very much for tuning in. Thanks for watching. And thank you, Sir Harold, for spending a few minutes with me. And I will see you in Las Vegas.
You got it.
Thank you very much.
Thank you.